Thank you very much, Peter, for your kind introduction. Coming towards the end of the day is kind of a bittersweet, bitter in the sense that you would have had quite a lot of things already been said. So at the risk of boring you by repeating most of the stuff, I'll do the other thing, try to avoid that, and I hope in that cause I'll be able to stay in the middle of the road. Today I've been asked to talk about EDCTP and the experiences we've had towards ERA. Thinking about that is, I feel, it's like a pilot who have just been out of a storm and you're asking him to give a U-turn and drive through the storm once again. So please hold on to your seats and tighten your seat belts. EDCTP, probably for some of you who are not aware, this is a program between European member states and African states together with third parties. It's a partnership which aims at accelerating the development of new drugs, microbicides, vaccines, and diagnostics against the three main poverty-related diseases, which are HIV, AIDS, tuberculosis, and malaria. So with that statement, it is very clear that the program has got really European added value. First, it deals with a very global and very difficult problem, a problem which requires several partners to work together. And the inherent in the solutions are equally very difficult, partly because of the diseases themselves. They don't render easy to interventions. And partly the partners who are working with in third countries, they do not have the capacity to develop these interventions. So obviously it requires a joint effort, and that is the reason why in 2003 the European member states, together with the Commission, formed EDCTP, at that time under Article 169, now 185 initiative. The program, together as a group, have come with a joint scientific strategy and a scientific issue to be dealt by all partners, and administration of the program, and also a joint funding. So it's at 3 levels, and all of them have got their difficulties. Putting up a joint scientific program wasn't that difficult. The scientists and the member states, the policymakers, sat together and did that in what we call Joint Program A. And frankly speaking, this has been a good, it's been a revelation, because this has enabled quite a lot of member states which had no tradition of working together to work together. Some of them had no tradition of working with developing countries, especially when it comes to malaria, HIV, and tuberculosis. But now they're part of the program. So it did enrich partnerships and made them stronger. What has been difficult is to have a single administration in terms of every level, from single review, peer review, ethical review, and regulatory review. But I must say that after several trials and errors, we're coming through that again very well. Now, most of the countries do agree to a single review. Ethical review, by tradition, when it comes to clinical trials, everywhere you go, there's still the pattern that every country does their own review, every institution does their own review, but we are moving towards a joint ethics review as well. Regulatory review is common in Europe, in many other countries, that one country, when it does a review, others do accept, although in some few cases, this is not always the case. But at least that we are doing together now. Then integration of the national programs. Besides working together as a joint program, part and parcel of the program was also to bring together different member state programs into a coherent, integrated, single program. This has been difficult. Part of the difficulties, as were pointed out in the morning by other groups, was to start with, in the case of HIV, TB, and malaria, not every member state had a program, a comprehensive program for that matter. So what we've been doing is whatever programs that are in place to bring them together. And as I've said, of the participating countries, not every one of them have a program of any sort. To mitigate that, at the Secretariat, we have started mapping all the programs that are taking place in the various countries. And again, from our experience, this has not been an easy task either, because quite often, even within a country, when you ask them what are the programs taking place, not everybody knows what is taking place. So we have to do an inventory, and now beginning the coming of this year and the next year, we will also be doing active mapping of all the programs. But quite often, from experience, this is really an elephant's graveyard, as many people know. You start doing an inventory before you finish it, it is out of date, or you don't get full information. So this is one of the difficult areas. We are trying to improve that by making it mandatory for the member states themselves to contribute to the inventory, to contribute to the mapping, and put it on an open frame where everybody can go and look at the data for their own use. So this is one of the things that was already mentioned in the morning. One of the difficulties is the lack of sharing of the knowledge and information within member states. The other problem has been this, the funding part. Again, I'm sure you all know that every research council has got their own mandate, they've got their own procedures, they've got their own rules, and in some cases even laws that prohibit certain movements of funds across the border. This, again, we've been solving slowly, whereby we have got a two-track system. There are some countries that can put their funds into a common pot. There are others which can put what we call a virtual common pot, which was again discussed this morning, whereby, for instance, if you can't put your money to the common EDCTP administration, you can use it to support the clinical trial by either supporting directly the activity or supporting your own scientists who are involved in the trial. And another issue which has been mentioned in the morning several times is the question of IPR. The troubles with the IPR, we didn't, at EDCTP, our experience, didn't show this to be a major stumbling block, because quite often the participating countries or participating scientists would come with their own, what we call background IPR, but by joining into the partnership, into the networks, any new discovery then will be owned jointly as a foreground IPR. And by participating, at least you will have to agree your background IPR can be made available to others as far as the work is concerned, so that if they need some information, there shouldn't be any obstruction as long as they observe confidentiality agreements. So what are the problems in the context of ERA? The three main areas which have been covered the whole of morning several times here. To us, one top in the list is the lack of capacity, so the need of capacity strengthening. The very fact that these international corporations work with third countries, some of them developing countries, you will want, if you want to have a true partnership, you will want to have improved capacity in some of these countries. But again, quite often people, they just think that it's a one-way traffic. But frankly speaking, even in our European member states, we need capacity, and by working with third parties, we enrich the lack of capacity in particular fields that we're working on. And then, of course, in the morning, we talked quite a lot about attracting talent, but in international context, it's really not just talent, but also by attracting talented networks. Because out there, I mean, it's not just the Europe. I mean, the same networks and partners we're working with, they are working with other partners, either in industry or with other developing countries, like, say, Canada, Australia. So how do we work with the best talent is how can we attract them to work with us? The question of gender was described several times in the morning and even today in the afternoon. But when you are dealing with international cooperation, you can see there it is now a three-dimensional jigsaw puzzle. It's not just the gender equality in the European member states, but with the partners we are working with the stakeholders we are working with in developing countries, in industry, and so forth. So we have to balance all this. And in our case, where we are doing clinical trials, we also have to include people who participate in the clinical trials, because morally it won't be right for us to support clinical trials where the female partners or female participants can't participate in clinical trials. For instance, they're not allowed by the husband or the culture doesn't allow that. So we have to deal with all those things in international dimensions. To end, I would like to leave you with a few questions and a few challenges that were probably we could give a thought during the discussion time. First of all is with those all multiple partners, one of the problems we faced time and again is the coordination of activities. Quite often when you're having lots of stakeholders, everybody wants to coordinate, nobody wants to be coordinated. So how do you bring the partners, researchers, institutions, private sector, public sector to work together? And we've been doing this through the Secretariat, and I must say this has been working out very well. One of the ways we do we bring them together is through the stakeholder meetings. Before we put up any call, we call all the stakeholders, people in the industry, scientists from developing countries, scientists from European member states and the European Commission to discuss the state of the art, and then based on that, that's when we put up a call. And I think this has helped a lot in getting buy-ins from all the participating partners. Then, of course, the question of harmonization and alignment of the European needs as well as our partners in developing countries and the industry. What do they need and what do we need? How can we meet and form a common ground? This, in a sense, is also related to the first activity I mentioned, coordination of the stakeholders. And then, of course, the question of the member states themselves when you're partners. This was mentioned several times in the morning. People moving at different speeds, both in terms of political as well as financial commitment to the program. And this tends to be one of the areas that you have to proactively monitor and keep on nudging individuals so that we all move towards the same direction, preferably at the same speed where possible, sharing the risks and the benefits together equitably. Then there is a question of national and international information knowledge management, knowledge flow, which I mentioned earlier on. And we're improving that by putting our data in a common database, and as well as allowing member states to have access to the data. And the last thing, but not the least, again, this was mentioned several times in the morning and even in the afternoon today about the mobility in case of visa procurements, work permits, short-term visits, and so forth. If it is difficult within Europe, you can imagine when it is international dimension, and I think this was mentioned in the session just before this, you can imagine a scientist coming from developing country to work on a short term or to learn new techniques here. This has always been difficult to obtain visas and work permit. I think this is all I have to say at this stage, and I'll be ready to join in the coming issuing discussions on the subject. Thank you very much.
Thank you, Professor Mgone. I think we have to continue, so I would like to invite the next speaker, Dr. Silvia Schwag-Selke, who is Executive Director, International Strategy and Networks at the Swedish Agency for Innovation Systems, Vinnova. And she is a well-known China expert, not only in Sweden, but also at the European level. Please, floor is yours.